According to the guideline of the National Primary Healthcare Development Agency, and in line with world standard requirements for primary healthcare centers, the following minimum standard must be met: functional separate toilets for males and females, availability of clean water supply within the facility, connection to a power grid and other alternative power sources, delivery room, inpatient ward section, maternity line section, 6 junior community health extension workers, 2 health attendants, 4 nurses and midwives, a detached building of at least 13 rooms, 1 pharmacy technician, 1 community health officer, and 1 medical officer. That's the standard. But it is different at many PHCs visited in the last 1 month. The next series of the program will focus on the state of primary healthcare centers in 6 states across Nigeria. On this episode of Community Forum, we're in Ondo State, the Sunshine State. We share the stories of how health workers who are frontline survivors manage to get by on meager earnings, limited hospital supplies, and shortage of staff, waiting for months to get their allowances after the Skills 3.0 COVID-19 vaccination program ended. As of the first week of January 2023, Nigeria has recorded 266,110 cases of coronavirus, with 3,155 deaths, giving a case fatality rate of 1.2%.
Our advocacy call initially was for government to increase budgetary allocation to healthcare. We were even part of the group that advocated for the Basic Healthcare Provision Fund, where we even led campaign at the National Assembly and got thousands of signatures, and then that funds were approved and budgeted for. But as the pandemic hit, the lesson we learned was, one, even with our advocacy before the pandemic, government was not heeding to our call and demands. And that's why Nigeria was not prepared, and Nigeria bear the brunt.
2 years after the pandemic, many Nigerians seem to have moved on, despite the severe impact the pandemic has had on the health system. Disruption of health services, low motivation of the health workforce, and massive exodus of personnel due to poor funding. Ondo State is part of the top 10 states in Nigeria to have recorded more than 100 deaths during the COVID-19 pandemic. It remains one of the states with the least vaccinated population. At the forefront of the vaccination campaign are primary healthcare centers across Nigeria. Rosalind Yewande Ajadi is a community health assistant at the Primary Health Center in Agbaluku, Arigide Akoko, one of the suburbs of Akoko Northwest Local Government Area of Ondo State, Southwest Nigeria. For 10 years, Ms. Yewande did almost everything that would make her qualify as a health personnel, spending fortunes to get a certificate. Since 2018, when she started working under the Empower program, her monthly earnings are yet to reach the 30,000 naira minimum wage mark. In spite of that, she and her team constantly go into the 12 communities attached to the facility with the COVID vaccination message, but it's difficult sometimes.
Láti 2020 tá a ti ń ṣe COVID-19, mo wà lára àwọn nǹkan tó tán jọ ń ṣiṣẹ́ COVID-19 yẹn. A jọ ń ṣe outreach kiri ni, so àwọn èèyàn dẹ̀ turn up fún COVID-19 vaccine ní ìgbà yẹn dáadáa. Nǹkan tó kàn ṣẹlẹ̀ tó tún fa ìfàsẹ́yìn bá àwọn èèyàn ni pé tó yẹ kí wọ́n wá, àwọn míì báyìí ti dì fún second dose, kò sí vaccine tó yẹ kí wọ́n gbà bíi Pfizer kò sí ńlẹ̀. Sẹ̀wọ̀n pé àwọn tó gba Johnson náà ni wọ́n tún padà gbà. Èèyàn tó gba Moderna, Pfizer ló yẹ kó fi gba second dose, but kò sí. Tàṣó second dose yóò jẹ́ káwọn èèyàn fàsẹ́yìn. Èèyàn tó ti rìn bí ẹ̀márùn-ún, ẹ̀mẹ́fà tó rí vaccine gbà. So kò sí nǹkan tó fẹ́ gbà.
Many Nigerians may have forgotten the dreadful moments COVID brought and the deaths recorded during the pandemic, with states like Ondo still lagging behind on the vaccination table. The health system is threatened, particularly for children under 5 and pregnant women.
Gbàtà kọ́kọ́ bẹ̀rẹ̀ ń gbà yẹn, COVID-19 yìí wọ òkè. tó yẹ pé a bá ṣiṣẹ́ wọ́n fún wa ní nǹkan a dẹ̀ ń gba owó wa but this time around tá ti ń ṣiṣẹ́ eléyìí yàtọ̀ wàá ṣiṣẹ́ kò sówó past 3 months àti bẹ̀rẹ̀ eléyìí wọ́n ní 2 weeks wọ́n fẹ́ máa fún wa lówó wọn fún wa kankan tó yẹ pé olúkàlùkù dẹ̀ ń lo owó ẹ̀ tó fi ń ṣe transport tó fi ń ṣe everything wọ́n fún wa lówó a ní challenges kìíní kan bíbáyìí one ó kéré a ní ìdíkan extend díẹ̀ fún wa ẹlẹ́ẹ̀kejì kò sí staff rárá tó yẹ kó tẹ̀ máa attend sí àwọn èèyàn ẹlẹ́ẹ̀kẹta tẹ̀tẹ̀lẹ́ wọn máa ń kó oògùn wá báyìí kò sí kan free mọ́ so àwọn èèyàn wọ́n nídìí pé tán bá wá at least owó díẹ̀díẹ̀ tán bá ìjọba bá kó oògùn fún wa wọ́n lè máa rí oògùn fún àwọn èèyàn. bí anti-malaria àwọn ọmọ kéékèèké báyìí under 5 tẹ̀tẹ̀lẹ́ owó wọn is free but now kò sí bẹ́ẹ̀ yẹn mọ́ nǹkan tó bá ti aláboyún gan tẹ̀tẹ̀lẹ́ ọ̀fẹ́ ni wọ́n dẹ̀ máa ń kó nǹkan fún wọn tó yẹ pé wọ́n máa lò but báyìí tó bá dé owó tó bá ṣe oná lèèyàn fún wọn lọ́wọ́ oògùn á fi kó wá bíbá ìpadà torí community wọn fi bẹ́ẹ̀ yẹn lówó àti ilé èèyàn tó wá lé níbà tó jẹ́ kó ó yẹ ká fún ní oògùn tó ṣe but kò sí ju 1,000 wọ́n dẹ̀ gba káàdì ní 1,000.
Every day she resumes work, hoping that things will get better. But her hope is thinning out. No word on a salary increase. The thought of working here under relative harsh conditions with paltry earnings and started allowances tears her up.
Ó ti ń dùn mí kéèyàn kàwé for 17 years tó wà 20,000. Ṣé mọ̀ so ẹlẹ́dàá mi kò ṣiṣẹ́ mọ́ January bí. So it's okay. So 17 years èmi nìkan lè dóńdé dọ́tà dáàdì mi ó dẹ̀ ti ń dàgbà so déèyàn bá kàwé ó yẹ kéèyàn ṣiṣẹ́.
Although the COVID-19 pandemic saw the facility being upgraded from a basic health center to a primary health center with constant electricity and an incinerator for medical waste, this facility needs portable water and space to accommodate out and in patients. The contract staff are placed in the 8,000 naira to 20,000 naira salary band. Most of them are just at work to sharpen their skills, hoping to catch the next flight to greener pastures if the funds are available. Rosalind's story is mirrored at auto facilities we visited, 10 minutes away from the center on Maternity Street. An uneven road leads you to another PHC in Imo, Arigidi Akoko. Here the signpost reads 24 hours in service. But the situation at the facility presents its own challenges. Shortage of staff, insecurity, and fear of the unknown stop the health workers from running the night shift.
90 days no sọ pé a fẹ́ fi ṣiṣẹ́ yẹn but now àrówó gbà àwọn yẹn dẹ̀ ní emid and vaccinator wa so wọn due to pé wọn rówó gbà wọn encourage láti wá mọ́ bá tilẹ̀ pè wọ́n wọn dá wa lóhùn so àwọn ló dẹ̀ mójú ìlú tí wọ́n mọ̀ bọ́n ṣe lè bá wa fi ọgbọ́n kó àwọn ènìyàn jọ láti lè gba vaccine yẹn bó ṣe tọ́ àti bó ṣe yẹ so due to pé wọn ò rówó àwọn náà wọn wá fẹ́ fi taratara ṣiṣẹ́ yẹn mọ́ ẹ jọ̀ọ́ kẹ́ bá wa rọ ìjọba kó fún wa lówó iṣẹ́ tá a ṣe so that kí iṣẹ́ yẹn lè máa lọ bó tún ṣe yẹ kó lọ even though ọ̀pọ̀lọpọ̀ káàdì wà nílẹ̀ tó yẹ ká synchronize ẹ̀ due to pé kò sí data àti owó fáwọn tó yẹ kó ṣiṣẹ́ yẹn so káàdì yẹn kò wà nílẹ̀ ni wọn ò ṣe àwọn èèyàn dẹ̀ ń wá láti wá gba káàdì yẹn due to pé wọn ò rí ṣe àmọ́ bá ṣe lè fún wọn ní káàdì yẹn láì synchronize ẹ̀.
As the assistant officer in charge, it's daunting to cope with the number of challenges, particularly the ones COVID brings.
Ní center wa ń bíbá àlẹ́ tó positive but another facility wọ́n rẹ̀ tó positive bẹ́ẹ̀ but ní center wa ń bíbá àlẹ́ positive case but ní 2021 ìgbà tí COVID-19 vaccine dé àwọn immunize àwọn tó wà eligible sí vaccine yẹn from 18 years and above là ń fún ní vaccine yẹn a dẹ̀ dúpẹ́ pé àwọn èèyàn dẹ̀ cooperate wọ́n jáde táwọn náà ń sáwà ó polongo pé vaccine COVID-19 vaccine ti dé o fún ọmọ 18 years and above pé kí wọ́n máa gbà á ní center so wọ́n wá sí center láti wá gbà á dẹ̀ tún lọ sí community a ní 5 community ní èrò ìmọ̀ Arigidi 5 community la ní so àti camp ní so a ní ìyú a ní òsín a ní ìtà a ní ìjẹ̀bú a ní ìrájú àti gà àwọn fúlàní gbogbo ibẹ̀ náà la máa ń gbé vaccine lọ wọ́n dẹ̀ corporate wọ́n máa ń gbà á tó bá ní àwọn àgbà fúlàní tó yẹ pé wọ́n sán lórí wọn ò fẹ́ gbà a máa ń pe àwọn àmọ̀tẹ́kùn wọ́n máa ń sìn wá lọ síbẹ̀ láti ṣe security fún wa.
The number of persons vaccinated may be higher than what we know if there is money and enough data to synchronize the information at the facility with the National Primary Healthcare Development Agency. This facility is not as lucky as the one at Agbaluku. The building is falling apart. No potable water or electricity. They depend on solar to preserve the vaccine.
Gbogbo center, gbogbo ẹ̀ ló ti ń leak, ló ti ń jò. Omi kànga tá a ní tá a ń lò. Ọ̀gbàrà ń wọnú ẹ̀. So ẹ jọ̀ọ́ bóyá kán bá wa ṣe drainage sí center wa, kán dẹ̀ bá wa tú facility yẹn ṣe. Gbogbo bẹ̀ ọ̀dà ẹ ti ń peel. Téèyàn bá dúró gan tó bá fẹ̀yìntì, gbogbo ara èèyàn ló máa dọ̀tí tí ò ní ṣe. So gbogbo bẹ̀ ẹ jọ̀ọ́ ilẹ̀ náà a tún need kan jọ̀ọ́ kán bá wa táì sí ẹ̀. Àwọn ọ́fíìsì kọ̀ọ̀kan wà tá ì need tí ò sí. Tẹ́ bá wò ẹ rí pé akọ́bì kan débì kan bẹ̀t kò sí agbára kò sówó láti lè fi parí ẹ̀ ká filẹ̀kùn sí.
Run by 5 staff with about 10 contract staff who are depending on meager earnings to come to work. Villagers in Agbaluku and Imo are tired of going to the facility for vaccines and cards because most times there aren't enough staff to vaccinate or reconcile the records.
I need this new health center, I need our staff. I need the support ìjọba kan fún àwọn ní àwọn oògùn. Àwọn náà ní sí báyìí ọ̀pọ̀lọpọ̀ àwọn àgbẹ̀ wọ́n ti ń ṣiṣẹ́ oko nísìn ọkọ̀ á gé wọn lẹ́sẹ̀ kí wọ́n á gbé wọn wá sí health center. So inú wa ò kí ń dùn nígbà míì tó yẹ pé kò ní sí oògùn tó lè fi sí ìtàwọn àgbẹ̀ wọ̀nyẹn ẹni ní aṣáájú lọ sí Àgbálùkù tàbí Ewúṣú gbogbo patient tó yẹ kó máa attend wọn bí báyìí wọ́n sá lọ sí Ewúṣú tàbí Ìkàrẹ́.
There's no workers there. I think we have only 2 workers there, and some of time when you get there you will not see any workers around.
It's time to go home. Getting a vehicle to town is difficult because of the bad roads. Buried in the extremes of this coastal city is the sleepy town of Kiribo, Esel, the local government area of Ondo State. Out of the 10 persons we asked if they had heard about the virus or taken the vaccine, 8 were indifferent. One elderly person told us a large percentage of women in the town refused to take the vaccine. And for those who took it, they had little or no knowledge about the vaccine. They just took it thinking it was a routine vaccine.
They thought that when they give them the vaccine, they will bring another sickness to their body. That's why some of them didn't take, they didn't respond.
Do you believe that COVID-19 exists?
I know that it exists before, but now there's no too much about COVID-19 here, COVID-19 there. Especially in this community, there's no any sickness that's come on that this COVID-19.
Àlẹ̀jáde sí wọn ọ̀pọ̀ tó ní kó wá ṣe àwọn gan lọ wọ́n dẹ̀ fún wa ní nǹkan tí wọ́n fẹ́ fún wa àlè fún mi.
Ọ̀ṣẹ́ mọ̀ nípa COVID-19.
Mi ò mọ̀ nípa COVID-19. À ń ṣàkábẹ́rẹ́ fún wa àlè gbábẹ́rẹ́ wọ́n sọ pé àrùn tí ò dá ní.
For young people like Moraki Oshowore, who is in his 30s, he thinks coronavirus is a hoax. He subscribes to herbs rather than vaccines and used face masks when necessary.
Here in Kribo, people don't believe in it. To them, it was just like an illusion, or something like a charade. So, greater percent of people did not believe it, including myself. I didn't believe there was any outbreak called COVID-19. I did not take the vaccine.
Why?
Because I didn't believe in the vaccine. And more so, the news I hear from people that after they take the vaccine, the side effects is so scary. So I just choose to ignore it. Like here in this community, it will be more than 10% who took the vaccine. So the other 90% did not believe it, or were just systematically running away from it.
The COVID discourse sounded repulsive. All they wanted us to see was the poor conditions of boreholes and water tanks, power transformers covered with weeds. Unlighted street lights and the effect of youth unemployment in their community.
Even look at healthcare. Women and girls and children are the mostly affected. You see, in Nigeria today, when a woman is pregnant, their family members start to do night prayers and fasting for safe delivery. In the US and in the UK, when women are pregnant, it's a thing of joy and celebration. But here is a thing of sadness, because what it means is when the lady is giving birth, she's between heaven and earth because of the lack of facility and manpower to ensure that she have a safe delivery. And today, that's why you have high level of maternal mortality and newborn. And so for us at Connected Development, why we're doing this is to say that, we want to ensure we're able to empower the marginalized, but most importantly, provide better services for the underserved, for the marginalized, but most importantly for women, for innocent children, and for girls. And to just ensure dignity of life and respect for human rights and humanity in general. And so that's why we started this project, focusing on primary health care, taking lessons from post-COVID-19, how we can build back better, but most importantly, preparing for the next pandemic, bridging the data gap amongst key policy decision makers, the private sector, and also get towards achieving the Sustainable Development Goal that talks about healthcare and well-being. If you want us to reduce, the inequality in the society and reduce poverty, and by the way, when you look at indicators of poverty, healthcare is one of it, and you have over 130 million people who are poor. What it means is over 130 million people cannot access healthcare, or when they even access it, they pay from out of pocket. So our resolve is, why can't we adopt some of this healthcare insurance plan? I know Kogi State now have a healthcare insurance plan. Kwara State also have adopted that, and this also is some of the inspiration from the the healthcare provision funds. So I think we just need to scale on it. But most importantly, invest in healthcare, invest and bring private sector buy-in. Because when you have healthcare insurance plan, it is the private sector that drives it.
Kiribo relies on generator to get electricity. General J. White Business Center is a one-stop for phone accessories and those who want to make financial transactions since there are no banks.
Bóyá láti gbàrà tán tí bí mi ò bọ̀ ilé tán ti bí mi tí rí náà rí gọ́sẹ̀ bó ṣe wà ẹ́ bóyá yàtọ̀ sí náà ilé tí jẹnẹrétọ̀ tàn yín mi rí náà jọba rí o. Business gẹ̀ mo ń repo ní o, mo ń ra petrol ní èdè ìsìn mo máa ń lo 30 litres mo fi ń tanná 30 litres mo fi ń tanná because 30 litres of fuel mo máa ń lò mo fi ń tanná lọ láti àárọ̀ mọ́lẹ̀ àárọ̀ mọ́jú mo máa ń tanná 24 hours. Àwọn manager náà ìjọ mi ìgbà mi wà a máa make profit ìgbà mi wà èèyàn make profit èèyàn manager náà because tí ibi tó rí bá ti dání sí èèyàn gbà bẹ́ẹ̀ Nàìjíríà tó yẹ kí wọ́n dá wa sí lélẹ́yìí so a manager bẹ́ẹ̀ so yàtọ̀ sómi tó wà lódò omi tó wà lódò wa mẹ́ẹ̀ kò sómi gangan mo máa ra pure water mu ni mo máa ra pure water náà mu àwọn tó bá ra pure water bá lọ pọn mi sometimes tá a bá tó rómi a lọ pọn mi lébùté ń bẹ àá mú
Under the blistering sun, the river gives solace to its children, serving as a bathing pond to those returning from farms. Odigbo local government is one of the most populated areas in the state, housing people from Oyo and Osun states as well as the Ikale people of Irele and Okitipupa local governments. Mobilizing people to get vaccinated has been difficult for the health workers. The population outweighs the health personnel.
Because of the awareness, we have large turnout in the local government. They troop out to receive this vaccination, which makes the virus, the pandemic or the disease to reduce in our community. And also the community, the health workers that go about for this vaccination, they receive some stipends for them to go from one community to other, to all those terrains to vaccinate people in the community. Then we finished that one. Another scale 3.0 was introduced around August, in which the partners, the National Healthcare Development Agency promised that they will be paying the workers 2 weeks stipends, at least to go to all those terrain and for the job done. But I was surprised, up till now, there is nothing, no penny was given to all these health workers, and they have worked tirelessly. Some have exhausted their resources, their energy on this vaccination. Some even use their salary to go from one community to another. The money they are giving to us, not that it's enough, but just for them to see it as a compensation or settlements that they will spend 40,000 naira a day per day to the LGA, even from one settlement to another. There are some that will spend 16,000 naira per day, come back to their health facility. But up till now, they have not done anything. And to worsen the situation, they integrate COVID-19 into measles campaign. The measles teams were given stipends for their transport logistics, while the COVID team were not giving penny, and they have not paid them for the past 90 days.
As frontline survivors during the COVID-19 pandemic, these health workers are still fighting worse viruses and trying to survive with little money in their pockets. For about a month now, we've been trying to speak with the Commissioner for Health in the state and the Executive Secretary of the State Primary Healthcare Board. The meetings have been postponed severally. We're hoping after now we'll be able to get a response from them as soon as possible, and these health workers will be paid their allowances and their facilities upgraded.